Hello, this is Professor Capron. Welcome to today's lecture on the electrical anatomy and physiology of the heart. By the end of today's presentation, you should be able to understand the components of the heart's electrical conduction system, describe the role of each component in generating and transmitting electrical impulses, explain how electrical impulses lead to coordinated contractions of the heart, and recognize the significance of each step in the conduction pathway for effective cardiac function. I want you to take a look at these key terms. I'm not going to read them to you, but please do pause the video and make sure that you understand what each of these terms mean. If you're struggling with any of the meanings, come back to this slide at the end of the presentation and see if it makes more sense. The heart's electrical system is essential for its function as a pump, ensuring blood is efficiently circulated throughout the body. This system is like the heart's own internal electrical wiring, making sure that each part of the heart contracts at the right time, in the right sequence, to maximize the efficiency of blood flow. The heart pumps blood to deliver oxygen and nutrients to every cell in the body. To do this effectively, it needs to contract in a very specific, coordinated manner. This is where the heart's electrical system comes into play. The electrical impulses that travel through the heart ensure that the atria, the upper chambers, and the ventricles, the lower chambers, contract in a synchronized way. This coordinated contraction is what keeps blood moving efficiently from the heart to the rest of the body. These electrical impulses originate from specialized cardiac cells that have the unique ability to generate and conduct electrical signals. These cells are found in key areas of the heart, such as the SA node, the AV node, the bundle of His, bundle branches, and Purkinje fibers. Each of these components plays a critical role in the overall conduction system, ensuring that electrical signals are transmitted in a timely and orderly fashion. If the electrical system is working correctly, the heartbeats are synchronized, and this means that the atria and ventricles contract in a coordinated manner. This coordination is vital. It ensures the ventricles are filled with blood from the atria before they contract to pump blood out to the lungs and the rest of the body. This maximizes the volume of blood that gets pumped with each heartbeat, which is critical for maintaining adequate circulation and blood pressure. However, if there's a problem in the conduction system, it can lead to various types of arrhythmias, which are irregular heartbeats. For example, if the SA node, which is the heart's natural pacemaker, fails to generate an impulse properly, or if there's a blockage somewhere in the conduction pathway, can disrupt the timing of the heart's contractions. This can cause the heart to beat too fast, too slow, or irregularly, leading to inefficient pumping of blood. This inefficiency can result in symptoms such as fatigue, dizziness, shortness of breath, or even more serious complications like heart failure or stroke. Understanding the heart's electrical conduction system is foundational for diagnosing and treating heart conditions. By knowing how the electrical impulses travel through the heart and how they coordinate the heart's contractions, healthcare professionals can better interpret ECGs, identify arrhythmias, and determine the best course of treatment to restore normal heart. The sinoatrial node, also called the SA node, is a crucial part of the heart's electrical conduction system. It is situated in the upper part of the right atrium near the entrance of the superior vena cava. This location allows it to effectively control the rhythm of the heart by initiating electrical impulses that spread throughout the atria. The primary function of the SA node is to initiate electrical impulses. These impulses are crucial because they set the pace for the heart's rhythm, essentially telling the heart when to beat. The SA node generates these impulses automatically, thanks to its unique ability to depolarize spontaneously. This is a vital characteristic because it ensures that the heart continues to beat regularly without needing external stimuli. The SA node acts as the natural pacemaker of the heart, meaning that it regulates the timing of the heartbeats. The rate at which the SA node generates impulses determines the heart rate. Under normal conditions, the SA node produces impulses at a rate of 60 to 100 times per minute, which is why a healthy resting heart rate falls within this range. If the SA node is functioning properly, it maintains a consistent and appropriate heart rate, adapting to the body's needs, such as increasing the rate during exercise and slowing it down during rest. When the SA node fires, it creates an electrical impulse that spreads across the atria, and this impulse causes the atrial muscles to contract. This is a process known as depolarization. This contraction is essential because it pushes blood from the atria into the ventricles, ensuring that the ventricles are adequately filled before they contract. Depolarization of the atria is represented by the T wave on an electrocardiogram or ECG. This small upward deflection on the ECG is a visual confirmation that the atria are contracting in response to the electrical impulse from the SA node. It's also important to understand that the SA node is influenced by the autonomic nervous system, which includes the sympathetic and parasympathetic nervous systems. The sympathetic nervous system can increase the firing rate of the SA node, resulting in a faster heart rate, such as during exercise or stress. Conversely, the parasympathetic nervous system can slow down the SA node's firing rate, leading to a slower heart rate during relaxation or sleep. The atrioventricular node, or AV node, is situated at the junction between the atria and the ventricles, specifically in the lower part of the right atrium near the interatrial septum. This position is strategic as it serves as a bridge for electrical impulses traveling from the atria to the ventricles. The primary function of the AV node is to receive electrical impulses from the SA node and delay them before passing them on to the bundle of His. This delay is crucial. It ensures that the atria have enough time to fully contract, then generates an increased force to push blood into the ventricles. This process is known as atrial kick, and it contributes significantly to ventricular filling. Without this delay, the ventricles wouldn't receive the optimal amount of blood, which would reduce the efficiency of the heart's pumping action. The AV node synchronizes the contraction of the atria and ventricles. By delaying the impulses, the AV node ensures that the atria and ventricles do not contract simultaneously. This coordination is vital for maintaining an efficient and effective heart rhythm. If the atria and ventricles were to contract at the same time, it would lead to ineffective blood flow and decreased cardiac output, which can have serious consequences for the body's oxygen and nutrient supply. After the SA node initiates an impulse, it travels across the atria, causing them to contract, and the impulse then reaches the AV node where it's momentarily delayed, and that delay typically lasts about 0.1 seconds. After the delay, the AV node transmits the impulse to the bundle of His, which is the next structure in the conduction pathway that we're going to talk about. The AV node can also take over as a pacemaker if the SA node fails, although it beats at a slower rate of 40 to 60 beats per minute when it acts as a pacemaker. This backup capability is vital for maintaining heart rhythm and function, even if the primary pacemaker fails. The bundle of His is located at the top of the interventricular septum. The interventricular septum is that wall that separates the right and the left ventricles. This location allows the bundle of His to effectively transmit electrical impulses from the AV node to the bundle branches, which then carry the impulses throughout the ventricles. The primary role of the bundle of His is to act as a transmission pathway for electrical impulses received from the AV node. After the AV node delays the impulses to ensure complete ventricular filling, it passes these impulses to the bundle of His. The bundle of His then swiftly transmit these impulses down through the interventricular septum to the right and left bundle branches. The speed and efficiency of the bundle of His in conducting these impulses is so vital. This rapid conduction is necessary to ensure that the ventricles contract in a coordinated manner. By transmitting the impulses quickly and efficiently, the bundle of His ensures that the electrical signal reaches the ventricles in a timely fashion, allowing for synchronized ventricular contraction. This synchronization is crucial for the effective pumping of blood out of the heart to the lungs and the rest of the body. The bundle of His serves as the bridge between the atria and the ventricles in the heart's electrical conduction system. Without the bundle of His, the electrical impulses from the AV node would not reach the ventricles efficiently, leading to a lack of coordination in ventricular contraction, and this would severely compromise the heart's ability to pump blood effectively. Furthermore, the bundle of His helps to maintain the sequence of the heart's electrical conduction. It ensures that the signal progresses in a controlled and orderly fashion from the atria to the ventricles. This sequence is essential for maintaining a proper heart rhythm and ensuring that the heart beats in a coordinated manner. Let's consider what happens if the bundle of His malfunctions. If there's a blockage or damage to the bundle of His, it can lead to a condition known as a bundle branch block. This can cause delays or interruptions in the transmission of electrical impulses to the ventricles, resulting in irregular heartbeats and potentially decreased cardiac output. Understanding this helps to underscore the importance of the bundle of His in maintaining a healthy and efficient heart rhythm. The right and left bundle branches are located within the interventricular septum. Again, that wall that separates the right and left ventricles. These branches emerge from the bundle of His, which sits at the top of the interventricular septum, and then extend down the septum, branching out to the respective ventricles. The right bundle branch directs impulses towards the right ventricle, while the left bundle branch directs impulses toward the left ventricle. So again, after the impulses are transmitted through the bundle of His, they travel down the interventricular septum via the right and left bundle branches. The right bundle branch specifically conducts impulses to the right ventricle, and the left bundle branch conducts impulses to the left ventricle. This conduction process is essential for triggering the contraction of the ventricles. When the electrical impulse reaches the end of these branches, they spread out through the Purkinje fibers, which are specialized conducting fibers located in the ventricular walls. We're going to talk about those in more detail next. The simultaneous conduction of impulses through both the right and left bundle branches ensures that both ventricles contract at nearly the same time. This synchronization is crucial for maintaining a coordinated and effective heart function. When both ventricles contract simultaneously, it ensures that blood is efficiently pumped out of the heart. The right ventricle pumps blood to the lungs for oxygenation, while the left ventricle pumps oxygenated blood to the rest of the body. The simultaneous contraction of the ventricles is essential for maintaining optimal cardiac output. Cardiac output is the amount of blood the heart pumps in a minute, and it is a critical parameter for that all body tissues receive an adequate supply of oxygen and nutrients. If there is a problem with either the right or left bundle branch, such as a bundle branch block, it can disrupt this synchronization. A bundle branch block occurs when there is a delay or blockage in the electrical conduction pathway of one of the branches. This can cause the ventricles to contract at different times. This is an uncoordinated and less efficient heart function. For example, if the left bundle branch is blocked, the left ventricle will contract later than the right ventricle, and this reduces the efficiency of blood pumping and compromises cardiac output. Additionally, bundle branch blocks can lead to abnormal heart rhythms, and they may require medical intervention, such as the placement of a pacemaker, to ensure proper conduction and synchronization of the heartbeats. Understanding the role and importance of the right and left bundle branches helps in recognizing and managing such conditions effectively. Purkinje fibers are found in the walls of the ventricles. They extend from the right and left bundle branches and spread out through the ventricular myocardium. These fibers form an extensive network that ensures the entire ventricular muscle receives the electrical impulse needed for contraction. The primary function of the Purkinje fibers is to distribute electrical impulses rapidly and efficiently throughout the ventricles. After the electrical impulse travels down the bundle of His and through the right and left bundle branches, it reaches the Purkinje fibers, and these fibers then transmit the impulse to the ventricular muscle cells. The rapid conduction through the Purkinje fibers is crucial because it allows the ventricles to contract almost simultaneously. This synchronized contraction, as we spoke about before, is essential for effective pumping of blood out of the heart. Specifically, remember, the right ventricle pumps deoxygenated blood to the lungs via the pulmonary artery, while the left ventricle pumps oxygenated blood to the rest of the body via the aorta. The primary role of the Purkinje fibers then is to initiate ventricular depolarization. Depolarization is that process in which the electrical charge within the heart muscle cells changes, leading to muscle contraction. When the Purkinje fibers distribute the electrical impulse throughout the ventricles, they cause the ventricular muscle cells to depolarize and contract. This coordinated depolarization and contraction is vital for maintaining an effective and synchronized heartbeat. Without the proper function of the Purkinje fibers, the ventricles would not contract in a unified manner. And again, this would lead to inefficient blood pumping and reduced cardiac output. Cardiac output, the amount of blood the heart pumps per minute, is essential for delivering oxygen and nutrients to the body's tissues. In the context of the cardiac cycle, the role of the Purkinje fibers is pivotal during the systole phase, when the ventricles contract and eject blood. If there is any disruption in the function of the Purkinje fibers, such as damage from a heart attack or other cardiac conditions, it can lead to arrhythmias or irregular heartbeats. These arrhythmias can significantly impact the heart's ability to pump blood effectively. Moreover, the efficient function of the Purkinje fibers ensures that the contraction of the ventricles is strong and coordinated, which again is crucial for maintaining adequate blood pressure and ensuring that blood reaches all parts of the body. In clinical practice, understanding the role of the Purkinje fibers helps in diagnosing and managing various cardiac conditions. For instance, when interpreting an electrocardiogram, abnormalities in the QRS complex can indicate issues with ventricular depolarization, often linked to problems in the Purkinje fibers or the bundle. Let's review the physiology of conduction within the heart. Understanding this process is crucial for grasping how the heart functions and how various cardiac conditions can affect its performance. Let's discuss depolarization. Depolarization is the electrical activation of cardiac cells. It occurs when the normally negatively charged cells within the heart muscle become positively charged. This change in electrical charge triggers the heart muscle cells to contract. To understand why depolarization occurs, it's important to know about the ion exchange that takes place in cardiac cells. In their resting state, cardiac cells have a higher concentration of potassium ions inside and a higher concentration of sodium and calcium ions outside. When an electrical impulse reaches these cells, sodium and calcium ions rush into the cell, while potassium ions exit. This ion exchange causes the inside of the cell to become more positive, leading to depolarization and consequently muscle contraction. Repolarization is the process of restoring the cardiac cells to their resting state. After depolarization and contraction, the cardiac cells need to return to their normal negative charge inside. This is achieved by the movement of ions again. Potassium ions move back into the cells, and sodium and calcium ions are pumped out. Repolarization is crucial because it allows the heart muscle to relax and prepare for the next contraction. Remember, let's look at the sequence of conduction again. This ensures that the heart contracts in a coordinated manner to pump blood efficiently. The sequence starts with the SA node, also known as the sinoatrial node, and this is located in the right atrium and acts as the heart's natural pacemaker. It generates electrical impulses at a regular rate, initiating the heartbeat. From the SA node, the electrical impulse travels to the AV node or atrioventricular node. The AV node is located between the atria and the ventricles. The AV node delays the impulse slightly and allows the atria to finish contracting and pushing blood into the ventricles before the ventricles themselves contract. This ensures that ventricles are properly filled with blood before they pump it out to the lungs and the rest of the body. After passing through the AV node, the impulse moves to the bundle of His. The bundle of His is located at the top of the interventricular septum, that wall separating the right and left ventricles. The bundle of His serves as a pathway that transmits the electrical impulse from the AV node to the bundle branches. Bundle branches are the next step in the conduction sequence. The right bundle branch and the left bundle branch run alongside the interventricular septum and conduct the impulse toward the right and left ventricles, respectively. This branching ensures that the electrical impulse reaches both ventricles simultaneously, which is essential for coordinated contraction. Finally, the electrical impulse reaches the Purkinje fibers. The Purkinje fibers are a network of fibers located in the walls of the ventricles. They rapidly distribute the impulse throughout the ventricular muscle, causing the ventricles to depolarize and contract. This rapid and widespread depolarization ensures that the ventricles contract in a coordinated and forceful manner, effectively pumping blood out of the heart. Let's review the clinical significance of understanding the heart's electrical conduction system. This knowledge is foundational for various aspects of cardiac care, including ECG interpretation, cardiac monitoring, and patient management. An electrocardiogram, or ECG, records the electrical activity of the heart. By understanding the conduction system, it becomes easier to identify normal and abnormal patterns in the ECG. For instance, the P wave represents atrial depolarization initiated by the SA node. The PR interval indicates the delay at the AV node, while the QRS complex shows ventricular depolarization facilitated by the bundle of His, bundle branches, and Purkinje fibers. The T wave represents ventricular repolarization. Recognizing these waves and intervals helps in identifying various arrhythmias such as atrial fibrillation, ventricular tachycardia, or heart blocks. Accurate interpretation of these signals can lead to timely diagnosis and treatment of potentially life-threatening conditions. Cardiac monitoring is essential for diagnosing and managing cardiac conditions. Continuous cardiac monitoring allows for real-time observation of a patient's heart rhythm and rate. This is particularly important in critical care settings, post-operative monitoring, and for patients with known heart conditions. Understanding the electrical conduction system enables healthcare providers to detect subtle changes or abnormalities in the heart's rhythm. For instance, detecting a prolonged QT interval can alert the provider to the risk of torsade de pointe, a type of ventricular tachycardia. Similarly, identifying ST segment elevation can indicate myocardial infarction, prompting immediate intervention. Cardiac monitoring ensures that any deviation from normal can be quickly identified and addressed. Recognizing abnormalities in the conduction pathway is vital for guiding treatment decisions. When a healthcare provider understands the underlying electrical conduction of the heart, they can better interpret symptoms and ECG findings to determine the appropriate intervention. For example, if a patient presents with bradycardia, a slow heart rate, and the ECG shows a prolonged PR interval, This might indicate a first-degree AV block. Depending on the severity and symptoms, treatment might range from monitoring to the administration of medications like atropine or even the placement of a pacemaker. Similarly, recognizing the presence of a third-degree heart block where there is a complete dissociation between atrial and ventricular activity would necessitate immediate intervention, often involving a temporary or permanent pacemaker. Understanding the conduction system also helps in patient education and preventive care. Explaining to patients how conditions like electrolyte imbalances or myocardial ischemia affect their heart rhythm can empower them to manage their health better. Patients can be advised on lifestyle modifications, medication adherence, and when to seek medical attention based on their symptoms and risk factors. Okay, so let's do a quick recap of the key points we've covered. First, we talked about the role of the heart's electrical system in ensuring efficient blood pumping. The heart's electrical system is responsible for initiating and coordinating contractions, critical for maintaining effective circulation through the body. We began with the SA node located in the right atrium. The heart's natural pacemaker, it initiates electrical impulses that cause the atria to contract. This depolarization spreads across the atria, triggering their contraction and pushing blood into the ventricles. Then we moved on to the AV node, situated between the atria and the ventricles. The AV node receives impulses from the SA node and delays them slightly. This delay is crucial as it ensures the atria have enough time to fully contract and fill the ventricles with blood before the ventricles contract. This coordination is essential for maximizing cardiac output. The bundle of His is the next key structure. Located at the top of the interventricular septum, it acts as a bridge that transmits electrical impulses from the AV node to the ventricles. This transmission is critical for ensuring the signal reaches the ventricles efficiently. We then covered the right and left bundle branches, which are located within the interventricular septum and extend into the right and left ventricles respectively. These branches conduct impulses rapidly through the ventricles, ensuring that both sides contract simultaneously. This simultaneous contraction is necessary for efficient ejection of blood from the heart. The Purkinje fibers are the final components of the conduction pathway. These fibers spread throughout the ventricular walls, distributing the electrical impulse. This widespread distribution ensures a coordinated and forceful ventricular contraction, pushing blood out of the heart and into the systemic and pulmonary circulation. Understanding the physiology of conduction is key. Depolarization is a process of electrical activation of cardiac cells, leading to their contraction. Repolarization is the restoration of the cells to their, preparing them for their next cycle of depolarization. Coordinated contractions are essential for effective heart function. We've discussed this a few times, so make sure you understand this concept. And finally, we emphasize the importance of this knowledge in clinical practice. Understanding the heart's electrical conduction system is crucial for interpreting ECGs accurately. This is vital for diagnosing arrhythmias and other cardiac conditions. Continuous cardiac monitoring allows for the timely detection of abnormalities, guiding immediate and appropriate interventions. Recognizing and understanding these conduction pathways and potential disruptions can inform treatment decisions, improving patient outcomes. So go on, guys. Get out there. Go do nursey things.